We'll open up for questions from the committee. And I'll start with a question about picking the starting point for trends. And in particular, when you or the CDC, and maybe I'll ask you to wear two hats, start talking about obesity trends, what guidelines do you use when picking that baseline year or referent year for the comparison?
Well, I can only talk about me. I can't talk about CDC. And I think that in particular, in our last paper, we picked 03, 04 because we'd seen no difference between 09, 10, 07, 08, 05, 06, and 3, 4. And so we wanted to say, okay, well, I think that my primary goal is, I want to get at what's happening now. How can I get most easily at what's happening now and not be influenced by big changes that happened a long time ago, because I want to see what the most recent changes are and how many years do I need to go back to get enough sample to do that, but not to go all the way back and get those changes that happened earlier.
So moving forward, would you think that your strategy would be 10 years back sort of each time, or? I think 10 years back is a good way to think about it, because you can then try to see what's happening now, because I just keep being influenced by, we want to know what's happening now, right? And if we could do it more recently, I think 10 years is probably a good way to do it. Yeah. Sorry, I don't have the best answer for you, but. Yeah. Other questions from the committee?
On now? Okay. Thank you so much for that fantastic presentation. I have a question about the use of age as the defining measure for trend in terms of what it means for developing children, particularly in relation to adolescence when pubertal changes happen, and we know that there are important changes in body fat distribution between boys and girls with puberty. So do we have data in NHANES on puberty, and do these analyses ever adjust for puberty and differences in pubertal timing between boys and girls and different racial ethnic groups?
These analyses do not adjust for that. NHANES has not consistently collected that information.
Very nice presentation. If you had the opportunity to improve NHANES, what would be the changes you would make?
Well, yeah, I would increase the sample size and try and have a big sample size so we could do state level estimates. But that would be, NHANES is I don't know what the exact cost is right now. I think it's about $35 million a year.
Out on that a little bit more. Can you talk more about how the sample size is determined? And for example, you mentioned they're adding an oversample, or they've added an oversample of Asian Americans. Does that add to the total sample size or detract from other groups?
Yeah. So based on the cost, the 5,000 per year is pretty much what we do. There are three sets of trailers that are around the country at any given time. There's one traveling, and then there's one in the field, and one kind of setting up. But really, that's because of cost. That's what we can do. And so, when an oversample like Asians comes in, it means it takes away from other groups.
Hi, Lynn Blewett, University of Minnesota. I have a couple questions. One I'll follow up. Is there any geographic part of the NHANES? Is there any region, census region, the big four census regions? Is that something that's been talked about, considered?
Well, there's often the geography is of interest, but in general, it's not representative of region. So it's hard to do that. People do some, but once you start getting get geographic data and start estimating things, you may not be as representative of that region.
But that seems like that could be a first step if you change the sampling frame to include geography, at least the four big reasons.
Frame.
Yeah, the sampling frame.
The sampling frame includes that. Oh, yeah. No, I think that...
Oh, you don't have enough sample is what you're saying.
Right.
Even by region, even by the four big census regions.
Yeah.
Okay.
Then 5,000 people per day.
Yeah.
Per year, not per day, per year.
The other question I wanted to ask you is about comparing the self-report Burfus with the NHANES. So for the older kids and adults, it seems like there's more consistent trend and they're closer, but for the young parent report there was. So would you advise the committee that at the older ages its self-report is close enough, consistently tracks, or, I mean, I know there's a lot of issues, but it seemed like the trend at least was lower, but the trend seemed pretty consistent over time.
Well, I think that's a whole field that you could look at. I think that it's not clear to me that the trends in self-report are the same as what's happening in measured. I don't know. But I showed only the adolescents over time, and that was the only thing I showed. The other one was just by age. It wasn't over time.
I thought you showed the parent report was really different than...
That was all parental report.
Okay.
It just, but it was by,
I see.
by age,
Yeah, right.
not
right,
over
right,
time.
Right.
So I think there are two issues. There's
Right.
one by age. There's this issue for parental report.
Right.
And then there's over time, has
Okay,
the reporting
right,
changed?
Right. Okay. Thank you. Thanks very much.
Validation studies?
So there are the self-reported data in Haynes looks better than the self-report from other studies. And sometimes people use the self-reported in Haynes to adjust other studies, but they're actually in between, and we think it's because people know they're going to be measured. But, we don't know for sure. But it's definitely, the self-reported data is closer to the measured in Haynes than it is in the other surveys.
Thank you very much for really enlightening us in a way that you can't read in a paper. So this has been incredibly helpful to us. I have a couple of questions, and they go towards your questions. So when you look at ages like 2 to 5, do you use a different analytic approach, such as quadratic modeling, given that during those ages you aren't supposed to be growing linearly?
Well, to just look at prevalence over time, or
right. How do you capture, because you must categorize them. Just as you said, you can't look at 2, 3, 4, 5. So you lump them as 2 to 5.
Well, we do that based on the sample design. Mm-hmm. So the age groups that we look at are based on the sample design of the survey. It's 2 to 5, 6 to 11, 12 to 19. Yeah.
Right. And so as you're examining, for example, I'm just pointing to the earlier ages for all the reasons you said. A lot easier to have measurement error. Just a tiny bit of change in height or weight makes a really big difference in what our findings are. And I'm just wondering, as we look at trends and how things are changing, the modeling approach for younger children versus older children, does it take that difference into account?
We want to be careful about not being cherry-picking analyses, you know what I mean, and having a broad approach on how we're doing an analysis on looking at trends, and not kind of looking around and, we got to do this one thing here and one thing there. And so in general, we, because of the way we've looked at the data, over a 10-year, we look at the linear trends, and that's the way we applied it throughout. Mm-hmm. But then, you can look at it. We have never done a trend test all the way back to 1971 for the kids. You can see with the little kids. It might be. There might be some good news in those little kids. We'll know more when we get the new data. But I think it just depends on how many years you're going to be looking at it. If you're just looking at a few years, you're probably not going to look at a quadratic 10, because if you have 3 points and it goes up and down, I'm not sure I would believe, even if it is a quadratic trend, it's significant with just 3 data points. I would want more than that. Right. So in general, I guess getting back to your question, we try to have a big picture approach on the analysis and apply that throughout what we're doing, instead of picking and saying, well, we got to do one thing here and one thing there.
Thank you. My second question has to do with how do we approach in Anna Haynes sampling strategies given changing demographics in America?
I don't understand the question. I might not be the right person to answer it, but I don't understand the question.
So the question is that the demographics in America have been changing fairly rapidly
Right.
over time and will continue to change. How, if at all, does that influence sampling strategies for
Well, it's
NHANES?
based on census data. The sampling frame is based on census data and working with statisticians at census and at the contractor that does the survey. So I think it does account for changes in demographics.
And then my last question for you is, what should the reference population be?
Well, I think the important thing is to make sure that when you're comparing data over time or between places or between groups, that you use the same one. I think that's the most important thing.
Thank you.
Hi, Cynthia, thank you for a very nice presentation. I also learned a lot through this presentation. Given some of the strengths and limitations you mentioned related to NHANES, specifically, the strengths, the quality of the data is, basically the gold standard as far as measurement of obesity. And of course, this system is ongoing, but on the limitation side, we're dealing with small sample sizes, and the data only released every 2 years. So just thinking at the national level, what do you see as NHANES' contribution to informing policy or even program evaluation, considering all the strengths and limitations? How could NHANES be used potentially?
Well, I think NHANES kind of provides that baseline on what's happening in the overall population. And it gives a comparison for local data to be compared to. Looking at national trends, you can look at that with NHANES. I think it creates great baseline data.
Okay, so I think I have 3 questions. The first one is about, I saw you a wonderful presentation. I wonder about the data from birth to 2 years. Has anybody doing that, or does
We've looked at that too. It's looks pretty much the same. I mean, it's flat recently too.
from birth to 2 years? Do we have data in that?
More recently, yes.
Yes.
The last 10 years, there's been no change in the prevalence of high weight for length among birth to 2-year-olds.
Okay. And then I wonder about the waist circumference. Has there been interest in looking into waist circumference as reference data?
I asked one of my colleagues I listed there, you think I should talk about waist circumference? Oh, don't bring that up. So big waist. Waist circumference, as you probably know, is it's a challenge in adults to do because people measure in different locations, and in kids it's a bigger challenge because you have the measurement issue, but you also have the issue of the cut point, and then what the reference population you're going to use for the cut point. And so there are many reference populations out there, and I have a great slide that shows a huge difference in the cut point. The value of the cut point depending on the reference population. So I think it adds more challenge. I think that this is definitely an area worthy of research, and people are doing work, but I think for overall kind of prevalence and trends, it would be a challenge.
Okay, so if we get back to birth to 2 years data, because children cannot stand, so we don't have the standing height. So we have the length measurements.
Right.
And the error for the length measurement is going to be very large relatively. So how do you use data for the birth to 2 years? Do you use weight, or you use weight divided by length square? How does that work? I know some people use weight divided by length square as BMI.
Yeah, I know people. We look at weight for length, and yes, there's more error in stretching kids out. I mean, NHANES does have a protocol so that hopefully it's relatively standardized across the country when the measurements are done. But we do use weight for length when we look at that age group.
Okay, so final question is, you suggested combining the surveys. So
in some cases.
Yes,
not all cases.
So in terms of combining the survey, for the data you present, do you have the sampling weight adjusted from the result that you show?
The weights, you use the weights for both, and you take the average.
Yeah, okay. Thank you.
Good morning. Can I not ask a question? Oh, okay, sorry.